Okay, so what I'm going to run through with you today is a bit of an overview of some of the things that our current solutions and products help you with in your day-to-day workflow within the practice and assist you with automating as much of that workflow to get the best out of your system as possible. So what we're trying to do here is help reduce the load on a practice, help enable different models of care within your environment, and help you engage and interact with your patients with as little effort as possible. So our Medtech Evolution and Manage My Health products we see as a very flexible solution for the health sector and a complete solution. So one that gives you all the aspects of practice management as well as the online management through the Manage My Health service where you can remotely monitor and manage your patients, giving you all sorts of capability and flexibility within the solution. So what I'm going to do now is run through a little bit of a journey of a patient, focusing on some of the key areas in the product where we can help speed up your workflow and speed up your efficiencies by offering you different products and solutions. So we'll just flick through here to the next slide. And the first thing we're going to talk about here is online appointments. So obviously, one of the ways that you can reduce some of the load within your practice, especially on your front desk, is offering an online appointment solution to your patients. So giving them the capability when they're sitting at home to make an online appointment booking, be able to see the availability of their doctor on certain days, even the nurse, and the times, morning, afternoon, evening, where they may be available and can choose a slot to book in. It's going to significantly reduce the admin time and the burden on your staff, and basically helps you also build an online presence for your practice. Our easy booking solution enables you to have things like an icon that sits on your web page that the patient can browse to, click, and take them straight into the booking solution. So this is just one way where we're trying to help you with that sort of interface. Obviously, after the patient has made their booking, what you want to be able to do is then have reminders for them. Obviously, no-shows in practices are quite a significant amount of administration to deal with. People not turning up, how are you going to fill that slot? Have you lost any money from it? What's the utilisation of your providers? So the automated reminder system that's built into Evolution can help you eliminate those no-shows with automated reminders. So we can enable text messaging for all of your appointment reminders through Evolution, and not just appointment reminders. So we can extend that to being able to send SMS messages for recalls for patients, send a statement of accounts via SMS. Even whilst a provider is reviewing an inbox result, send that notification to the patient as well, or do things like bulk SMS messaging through the Query Builder or our Clinical Business Intelligence tool. Of course, if you want to just quickly send a notification to a single patient, you can do that by a free text SMS reminder, or you can have templated services as well. So the SMS reminders also has a specific function in Evolution which allows you to do recurring SMS messages. So if you have a patient that you need to constantly prompt or remind about something that they need to be doing, you can set up a series of reminders well in advance to automatically send or be sent to that patient at the time that you've scheduled them to go. So once a month for 6 months, you can set it up to send those reminders as and when you require them. Patients can reply to those messages as well. So again, you're not having to sit on the phone, you're not having to send letters. You can have a backwards and forwards conversation with the patient via text and help reduce some of that administration time from using services like that. Obviously, patients going to arrive at the practice once they've had their appointment, they've been reminded, they're going to come in and they want to see their provider. So a significant piece of work that we've done recently is around our kiosk. So our kiosk offers an entirely new way to engage with patients and improve their experience when they're visiting a practice. So as they come into the clinic, they can walk up to the kiosk terminal, they can search for themselves there and be alerted of the time of their booking with their provider and check themselves in for that appointment. It means that they don't have to queue up and wait in line for patients that are paying for services at that time after they've already been in, and clog up your front desk area, they can go straight to that kiosk, they can check themselves in. And what they can also do at that point is also update any of their contact information from their demographic screen, as well as update information around their emergency contact or next of kin. So this is trying to simplify the workflows within a practice, and having that information of the patient check-in and arrival automatically sync with your appointment books basically means that you'll know that the patient's arrived. You'll also be alerted if they've updated their demographic information, and that information can automatically update your patient register as well. That means some of your improvement of data quality and integrity is also happening for you. So I'll talk a little bit more about the kiosk later on and some of the things that we're doing with that. The next thing that we're going to have a look at is around digital data. So one of the ways that we can assist you with capturing more information within your practice, whilst the patient is with a nurse, whilst they're with a provider, or any other services that you may be offering your patients that you want to capture information on that there doesn't currently exist a place within the product to capture that information currently, is by using advanced forms. So as a practice, you have the ability within the advanced form module to create and capture information to digitize your data. So you can set up advanced forms for particular services, you can set up forms for triage, you can set up forms even for consultation, and capture that information and use that to report on, use queries as well to extract the data. But it gives you some flexibility in how you're entering your data, how you're managing your data, and how you're reporting on the data for additional services that may be used within the practice. And moving on from that, we're looking at clinical outcomes and clinical efficiency. So the Evolution product gives you a very unique way to streamline your consultations with patients using customizable workflows and windows and modules within the application. So the Evolution system basically provides you with a number of different navigation panes, so you can see patient information and data without having to open up the patient manager or multiple windows within the application. And our clinical business intelligence tool dashboards, clinical dashboards, as well as your PHO dashboards, available quick and simple right on the screen where you need them. And each clinician can customize the workflow and the look and feel of their clinical interface to suit how they want to work when they are with their patients. We offer a very unique module called a widget for clinicians that want to group together specific windows or modules within the product when they're doing specific actions within the screen. A couple of examples of this: if you are navigating through your provider inbox, and whilst you're in your provider inbox, you want to see your patients' classifications, screenings, medications, you can see them all in one window. So you basically can configure it to what you're doing at that time in your workflow. For a nurse, you may be going through your recall contact list, and at the same time, for each patient in that recall contact list, you want to be able to view their screenings, their recalls, their medications, and for example, maybe their immunizations. So you can build one workspace area that allows you to see all of that information in one screen at a time. And each user can configure up to 10 different variant views of those things that they may want to configure for themselves. So obviously, once you've gone through your consultation with your patient, one of the things that you may want to do is capture an online payment for them. I'll talk about something later on that we're doing with online payments after service has been initiated. But prior to service being initiated, using our online payment functionality with Manage My Health, you can actually streamline the appointment services or payment for services, up front before the patient arrives at the practice. So we're talking about things like getting a patient to pay for a repeat prescription, or an email consultation, a video consultation, or when they're booking an appointment. So those transactions come straight into the Evolution application, so you can see them within the patient account, and basically you can collect that payment at the time of requesting the service and not after. So prepayment for things that are going through to help with some of the convenience and not having to worry about collecting the information, the payment after the service has been rendered. And one of the things that we've just initiated recently is automated scanning. So using our advanced scanning module, obviously you get a lot of pieces of paper for patients, you're scanning a lot of information, forms, that sort of stuff into Evolution on a daily basis. What we're doing with functionality called intelligent character recognition is providing the ability for an auto-matching process to go through and look at every scanned document that you're bringing into the system and automatically match the provider, the patient, and also annotate the subject field so that you don't have to open up every single scanned document automatically and individually once you've scanned them into the system and complete those actions. So working with a number of practices here, we've gone through a significant piece of work to implement this in the software. But what we're doing here is really quickly helping you with a process and a very manual one that you're doing on a day-to-day basis that's taking up a lot of time for your staff. And so we're looking to extend this capability later on, which I'll talk about into other areas of the application to again help automate and speed up some of those workflows. And then obviously once your patient has left the practice, you're looking at things around follow-up. So what can you do and what can you offer to your patient after they've left the practice to help automate some of those callbacks and those follow-ups that you may need to do with a patient? So using our Manage My Health services, you can obviously allow your patient to do online prescriptions. So basically allow them from the comfort of their own home to request a repeat on a medication and have little or no interaction with a GP or a doctor when doing that. And have a look at their test results online, reducing the requirement for them to have to phone up the practice and talk to a nurse and find out what their test result is, or for a doctor to find time to call the patient. As soon as those results are filed, they'll be available to the patient within the customer portal so that they can see the results of the tests that they have had, and they'll be notified of those as well. And then there's also the capability to use video consultations for follow-up with a doctor or a nurse. So video consultations basically allow you to see your patient online at your own convenience. It supports both what we call planned and unplanned consultations. So you can set up your appointment books to offer specific time slots for video consultation that a patient can book. Or if in an emergency or a triage situation, you can initiate immediately an unplanned video consultation just by sending a patient a link and getting them to click on it. You can also do three-way conversations via that video consultation. So you can do triaging and involve other people to reduce some of those avoidable visits for face-to-face consultations that may be required. So that's just some of the things that we currently have in our application, as well as what we're working on over the next few months of that are remaining of this year and into early next year. And if you would like to know more about any of those things that you've seen today, please feel free to request a call back as part of that exit survey at the end of the webinar today.